Hey, it's Roberto Mickey again, and we've got a great video today. It's actually just a question that is typically on the in-training exams and also for the boards, and so it's about leeches. So surprising to most people, we still use medicinal leeches in the 21st century. Can you believe that? So here's the question. After revascularization or replantation of a digit, medical grade leeches treat which problem? A. Debride vitalized tissue. B. Prophylaxis against deep venous thrombosis. C. Increase arterial inflow. D. Decrease venous congestion. Or E. Treat ischemic pain. So pause here if you want a chance to answer the question and think about it. So the answer is D. Decrease venous congestion. So medical grade leeches produce a potent anticoagulant called hirudin, and this anticoagulant allows for persistent bleeding and egress of blood. And these leeches treat venous congestion, which if the blood continues to back up in a revascularized or replanted finger, it can eventually stop the inflow of blood. The other important factor is that patients on leech therapy need to be on an antibiotic, typically to cover a bacteria called Aeromonas, which is typically treated with a quinolone such as ciprofloxacin or levofloxacin. I've also cited here an article which has a great protocol for leech therapy following digit replantation. Thanks again for watching, and please hit like and subscribe.